Vaccinate as many high-risk people as possible all across the nation.
But Governor DeWine says one group of people is pushing back against getting a COVID vaccine, and there are nursing home workers.
News 5's Kevin Barry explains why and what's being done now to change their minds.
The people that Oak Street Health care for across Ohio are often the older patients with a long list of conditions and complications.
In the midst of COVID, this is a population that has increased risks.
That's why Dr. Laulu Fayanju says he and his staff have conversations with patients all the time about why they should get vaccinated as quickly as possible. But across the state, caregivers in nursing homes are the ones pushing back.
The bad news is, as I've mentioned before, we're only running, we think, about 40% of the staff that is taking the shot the first time around.
That's despite the fact that roughly half of Ohio's deaths have come from their facilities.
It's discouraging. It's sometimes a little disheartening when you do hear about medical personnel who are privy to the information and have the data at their disposal will then reject this.
More than 45,000 first doses of the COVID vaccine have been given out in nursing homes all across Ohio, and the first round is supposed to wrap up in the next few weeks. But experts say it's distrust that's keeping nursing home staff from getting their own vaccine shots.
Probably the biggest thing that we've seen is I don't want to be first.
Pete Van Ronkel at the Ohio Healthcare Association says they're confident they can change the minds of medical professionals who refuse the vaccine by explaining how safe and effective COVID vaccines are. The problems so far have been caused by misinformation found online.
They share a lot of the same, social media and other sources that are questionable that everyone else does. So it becomes a little bit of a challenge to overcome that.
To fight back, organizations like Pete and the Ohio Nurses Association are sending information, encouraging members to learn more about the COVID vaccine, see that it's safe and effective, and share that with patients. At Oak Street Health, Dr. Fayanju says the staff is ready to get vaccinated now, but not before they had a few questions first. And Dr. Fayanju says he addressed them because transparency is key to building confidence.
A lot of those concerns have been allayed and people are ready to get vaccinated.
In Lakewood, I'm Kevin Barry, News 5.